Hi everyone! Before we go any further with relational facilitation, I first want to introduce you to relational coordination as the theoretical foundation for the relational facilitation process. Simply put, relational coordination is a theory that focuses on how connections between roles impacts organizational performance. All of us, in our work and personal lives, have experienced relational coordination. For example, it's when you try to organize a school group assignment, or a work deliverable, or more specifically, is when you discharge a patient from the hospital or coordinate care across specialties. In all of these examples, you are connecting with others to coordinate your work. Dr. Jody Hoffer-Gattel, the founder of relational coordination, identified 7 key behaviors that are critical to high-performing teams and work performance. 3 of these behaviors are relational-based. They are shared goals, shared knowledge, and mutual respect. The remaining 4 behaviors relate to communication, namely frequent, timely, accurate, and problem-solving communication. Together, these relational and communication behaviors act as a single construct, relational coordination. In over 20 years of research on this topic, high levels of relational coordination have been shown to positively impact the quality and efficiency of performance, as well as increase levels of worker and client engagement across disciplines. In healthcare, high levels of relational coordination have been shown to reduce family complaints, medication errors, hospital-acquired infections, hospital length of stay, healthcare costs, and increase patient satisfaction. For healthcare workers, high levels of relational coordination have positively impacted job satisfaction and engagement while reducing burnout and emotional exhaustion. At its core, relational coordination is a theory of performance. This means relationships shape communication, which in turn impacts performance. This can happen for better, with relationships built on shared goals, knowledge, and mutual respect, leading to communication that is frequent, timely, accurate, and problem-solving with strong performance outcomes. Or it can happen for the worst, with relationships that display a lack of respect or behaviors like finger pointing, as well as infrequent, delayed, and inaccurate communication that lead to poor outcomes. Relational coordination matters the most when the work being done is complex. If you can complete the project on your own, it doesn't matter as much if relational coordination levels are high or low. However, if you require input from others, if there are time constraints, or if there's uncertainty, ensuring high relational coordination enhances performance and outcomes. Let's build an example. Let's look at who is involved in the inpatient care of a veteran. In this case, 9 unique roles all interact with each other to support veteran care. In reality, I'm sure there's more. This is a complex and interconnected process with time constraints and uncertainty. To make this example even more complicated, this veteran may live in a rural community, or they may have complex mental health needs or lack social support. If the teams that work to support this veteran have high levels of relational coordination, the complexity may not be as overwhelming and the performance outcomes might be optimized. Why? Because relational coordination builds a culture that supports process improvement and helps individuals involved in a process see how they connect around and with each other. Also, positive relationships evoke positive emotion, which in turn helps build resiliency. To learn more about identifying those individuals integral to your work process and measuring relational coordination among your team, I invite you to visit our following video on relational facilitation or contact a member of our VA team.